When you want to recover from an ankle sprain, a lot of times we'll emphasize the active component of care as being the most helpful and the most effective. But passive treatment can really help to speed up recovery and help you feel better sooner. So we really like to use both active and passive treatments together. Some of the primary things we use for passive care of ankle sprains are, number one, finding repetitive directions to decrease strain on the injured ligaments. When we say repetitive movements, we mean that we're taking that injured joint and repeatedly moving it in the same direction over and over. We're talking 10, 20, sometimes 50 reps to help decrease the strain on those injured ligaments. Most ankle sprains are inversion injuries. So this is where you roll out towards the outside of your ankle. So most of the time when we find a repetitive direction, it's actually in the opposite direction. We're taking that ankle into eversion. And when we evert that ankle, we're shortening the injured ligaments, reducing some stress on those, which can help to significantly reduce pain, and it can free up range of motion in other directions as well. So finding a repetitive direction with an ankle sprain is always a top priority of ours. Another major component of passive care that we like to use in our office is pro-inflammatory treatments. We want to use our body's natural inflammatory processes to speed up healing. This comes through trigger point dry needling as our top choice usually, and we can also do instrument-assisted soft tissue manipulation, or IASTM, also called scraping. So both trigger point dry needling and scraping can be a great way to increase inflammation through the joint passively to speed up healing and help pain relief. Another component is adjusting. A lot of people think, well, I sprained my ankle, it's already moving too much, why would you adjust it? The answer is that no one is better off with joint restrictions. We have 26 bones and 33 joints in our feet. And that's a whole lot of places for the joints either to move well or to be a little bit restricted or stuck. And if we have limited range of motion through any of those joints in the feet, we're going to unnecessarily increase load on the injured tissue. So by adjusting those stuck areas of the foot, this is usually through the middle area of the foot, the midfoot, and into ankle dorsiflexion or ankle eversion, this can help to significantly reduce the load on the injured ligaments. The last major component of passive care in our office for ankle sprains is taping. We use kinesiology taping in our office, and it can help to keep fluid moving, help to keep that pumping action going to move along inflammation. This can also help to decrease load and decrease pain in the joint. So even though active therapies, I think, can help to long-term speed up recovery, help to reduce risk of further injury, passive treatments are really very important in making sure that we can progress and have more effective, quicker pain relief for the patient.